non-surgical BBL with a Sculptra. So I'm using here spinal needle. I like to get spinal needle, and I'm injecting as I'm coming back. I wouldn't say it's completely pain-free, but it's not as painful as if you're like in the dermis. So that's how you know actually that you're on the right plane. And I'm changing. I'm going like a circle. Again, I'm injecting. And as you know, Sculptra, the same thing. It's always great to massage the area a lot after you inject it. It's not as important as when you're doing the face. When you're doing the face, you really have to be very particular about it because you don't want any nodules. Okay, almost done. So what we're gonna do is 4 vials in each side. You know, each one is, I already mixed it, get it ready. So we have 8 syringes here, so we'll do kind of 4 on each side. Okay, already numbed the entry point with the lidocaine with Appy. We already marked the entry, the main place where we're gonna do the center, the main area that we want to lift. Because if you notice with each injection, at the end is gonna be all around this area. So that's the main area that get the most of the Sculptra. And okay, okay, same thing. I'm always measuring. I don't want to go too lateral or too medial. So the circle is maybe 1.5 inches around this area. So we're doing great. This is number 2. And then you can see sometimes I don't have to take the needle out. Okay, and then try to do it. Go out just before going out completely. And then we'll do a little bit on this side. This quadrant as well. Tethered, just releasing it. You can see how it is elevated here. Again, this is always great to massage. It's not as important as we're doing Sculptra for the face because, you know, tell my patients there's no limitation almost for this. And that's why people like the non-surgical BBL, because you don't have to have fat that we can, it's way quicker procedure, nicer, and the recovery is almost 0. You can just go ahead and continue with everything. While you do the surgical BBL, then you have to have limitations almost for up to 2 months. Okay, so that's number 3. Then we'll do more. So I always tell my patients either you do a lot one time or do like less than that. You know, we're doing 4 every few months. Then better than, I prefer this than putting like 10 on each side at one time, because this, I believe this is safer. A little blood tinge here is fine. I mean, we can apply some pressure and then it will heal by itself and it wouldn't, you know, stay as long. Okay, I'm gonna apply a little pressure, give her a little break. Almost done with this side. Again, when you do it, the main quadrant, although we're gonna do it like a circle to lift up, I don't inject down because that will drag things even worse. So it has to be a little high. So the main projection will be here and then it lifts everything up as well. Okay, so maybe a little bit in this area. Almost done with this side. And then we'll do the same thing to the other side. So that the Sculptra has the cellulose with the carrying component in the vial, and that's actually what makes it the foamy, and it's very hard sometimes to inject. But it's not the Sculptra particle, it's actually pure, but the cellulose. And that's why sometimes you have to minimize the amount you have there so that you can always inject without clogging the needle. Even bigger needles sometimes they clog. Okay, so we're gonna do the same thing on the other side as well.